Good evening. Welcome to another edition of the 411 Talk Zone radio show right here on YouTube. My name is Leon Jones, and tonight I'm going to get into something that, it has to do with the FDA. That's my background that you see here in this video, political, but it also has to do with health. Now, in America, you have a number of individuals who are trying to lose weight. Weight due to genetics, diabetes, you name it. Now, in the 90s and 2000s, you had the bariatric surgery where individuals were basically getting surgery. Now, I didn't agree with that because it takes a lot of nutrients out of your body. It makes your stomach smaller. And also, you can gain that weight back. And some individuals, when they got the surgery, they still had a lot of flabby skin left. And to make everything look good, some doctors had to use a skin graft to make everything match up. Now, I always believe in losing weight the good old fashioned way: proper diet, proper sleep, less stress, and less exercise. But you have a number of individuals today, and I call that weight loss surgery another version of cosmetic surgery. But there's something else that's out that people are using. I see a lot of commercials, and it's the GLP-1. That's a needle that you give yourself to help slow down your appetite. Now I'm not in favor of giving myself any needles. And with all of these drugs, and I'm going to dedicate some of these videos to these drugs that I see on television, because do they actually work? I believe you have a number of individuals who have a low self-esteem about themselves, and they're trying to make themselves look aesthetically pleasing by utilizing drugs. Now, the thing about America, we're hell bent on drugs. And just because a drug is legal, it does not mean that it is not addictive. Now, I know we have the diabetes, which uses a meter. After you prick yourself, draw a sample. You put the sample of blood into the meter, and it detects your blood sugar. But now, with this GLP-1, let's get into what it is and is it worth it? What is GLP-1? Well, GLP-1 is a glucagon-like peptide 1 receptor agonist are prescription drugs like Ozempic, Wegovy, and Mounjaro that mimic a natural gut hormone to lower blood sugar, slow digestion, and curb appetite. They are often worth it for significant weight loss or managing type 2 diabetes, but they can be expensive and require long-term use. And what you get out of this as well is an upset stomach. Now, how does the GLP-1 actually work? Well, what it does, it mimics your gut hormone to basically signal that you're full. In other words, it sends a signal of fullness to the brain. and it slows down how fast your stomach empties food. And it helps your pancreas or your pancreas, it helps your pancreas basically release insulin. Let's say that again. The GLP-1 helps your pancreas release insulin when your blood sugar is high. And it also reduces constant thoughts about food, often called food noise. Now, with every drug, there is a benefit and a drawback. Now, me, I have gotten enough needles in my life by getting teeth pulled, being in the military. I am not a fan of needles. This is why I don't know how druggies can stick themselves with a needle when they're shooting up. But now, if you look at everything, the benefits versus drawbacks. Well, it says it's proven weight loss, 10% to 15% of body weight, better blood sugar control and lower A1C, lower risk for heart and kidney disease issues. But for the drawbacks, common stomach issues, you're dealing with constipation, nausea, vomiting, very uncomfortable to me, high cost and potential insurance hurdles. Need for long-term use, because just because you use this GLP-1 piece of equipment or contraption, weight can return. This is why you have to utilize that contraption for long-term use. Now, let me bear with it. And I am looking at also some more downsides. And the downsides of using this GLP-1 receptor, again, it's like Ozempic. And you see all these commercials on TV, Wegovy or Mounjaro. You're going to have frequent digestive side effects, the risk of rare but serious medical complications, loss of lean muscle mass, high financial costs, and again, the likelihood of gaining the weight back after stopping the drug. Now, when you use this drug, you don't have to get any type of surgery. Again, your common effects, and I mentioned them earlier, you're going to have your nausea and your vomiting and your constipation. With your nausea and your vomiting, it's going to be very frequent, especially when you start using or raising the dose. So when you first start using it, your system's not used to this drug. You're going to have frequent nausea and vomiting. In other words, you're going to be uncomfortable. Diarrhea, constipation, bloating, and acid reflux. Also, you're going to have some fatigue and dizziness because you're going to have low energy levels from reduced calorie intake and mild dehydration. Now, also, you're going to have high risk of gallstones or inflammation, gallbladder disease, pancreatitis, which is a rare inflammation of the pancreas, gastroparesis, gastroparesis. And this is when you have severe and dangerous slowing of your stomach emptying. And also, just like metformin, you have to look at your kidneys. So you can have potential acute kidney damage, often linked to severe dehydration. Now, the long-term and practical drawbacks with this drug is muscle loss. And people don't understand that you can gain weight by putting more muscle mass on. And when you lose muscle, that is going to affect how your body functions. So rapid weight loss basically can include a significant drop in lean muscle mass if not paired with exercise and high protein intake. See, a number of individuals, this is like a miracle drug. All these drugs are out, but you have to go back to the good old dieting and good old exercise. And you're going to have a rebound weight gain if you stop taking the medication. And again, these name brand drugs, they're very expensive and they're not often covered by health insurance. Now let's go to the PowerPoint and get more in depth. Now, when we deal with the GLP-1 analogs on the market, you basically have to look at it like this. It's used, and this is where people are not educated. You use this type of drug as an adjunct to diet and exercise to basically improve glycemic control. And again, it's basically administered by a injection, a subcutaneous injection. In other words, it's like you're giving yourself a booster shot. Then you have your Vieta, which is your exenatide, twice daily SQ injection. Your Victoza, which is your larynglutide, once daily SQ injection. And then you have your Bydureon, extended release exenatide, once weekly SQ injection. Now, an overview. GLP-1's analog role in the body. The available GLP-1 analogs on the market. Advantages over other anti-diabetic agents. Benefits when combined with lifestyle modifications. Importance of a healthy diet, physical activity, and sleep with GLP-1 analogs. Nutrition and physical activity recreations. Now, I am not a doctor. I am not a nutritionist. I'm just giving you an overview, like I did a long time ago when I put videos out on why breakfast is one of the most important meals. So when we look at GLP-1 and type 2 diabetes, you can see this graph right here. You see the time and you see the GLP-1, and then you see everything up there. It's your meal, your NGT, your IGT, and your type 2 diabetes. Well, you look at your type 2 diabetes, it's up, but you can see after the drug use, and you see the time is in minutes. This is when, the funny thing about it is, your type 2 diabetes goes down, but then at the 4-hour mark, after, let's say you have a meal, everything's basically stationary, it's tied. With the analogs here, it's very synthetic and structurally altered version of naturally produced hormone. It mimics physiological actions of GLP-1. It's naturally produced GLP-1 are rarely inactivated by the DPP-4 enzyme. The GLP-1 analogs are resistant. They're basically resistant to inactivation by DPP-4 enzyme and stay longer in the body. And they work only in the presence of glucose. Now, what is glucose? Anything with OSC at the end, glucose, dextrose, it's all sugar. Now, if you look at the picture, how everything works, the mechanisms of action, glucose-dependent insulin production stimulates beta cells and causes insulin secretion, inhibits glucagon secretion, delays gastric emptying, induces satiety and decreases food intake, improves beta cell function and proliferation. Now, these are all animal studies. So, for the satiety and food intake, we're looking at long-term weight loss. Exact mechanism, however, is unclear. So basically, it acts on hypothalamic feeding centers. Again, I am not a medical expert. I'm just giving you information that I've researched by reading and by my PowerPoint. Again, on the market, you've seen this slide, but I'll give it to you again. What is it used for? It's just an adjunct to diet and exercise to improve glycemic control. And it's administered by subcutaneous injection. That's subcutaneous injection. Then you have your Byetta, induced twice, SQ injected twice daily. So you have to take an injection twice daily with Byetta or exenatide. So your liraglutide, which is your Victoza, is once daily SQ injection. Then your Bydureon, your extended release exenatide, it's a once weekly SQ injection. So you have to decide how you're going to take this. But I still just don't believe these commercials, because when you have a commercial, it makes everything look like it's very easy, but they don't tell you what goes into this weight drug and how it actually works. There used to be commercials on television. Models would come on, fit models, and they would talk about the exercise machines, and they would talk about different products to give you muscle mass. Well, one thing you must understand, everybody's body is different. So you have some individuals where they have basically, they have a slow metabolism or a fast metabolism. Now, you always want to speed up your metabolism, but even better than that, don't put a lot of calories in your body. Again, your safety profile. You're going to hear this again. Here are the causes. This is why you should have a side eye when you're looking at this product. You could have mild or moderate nausea. The titrating dose may limit nausea, diarrhea, headaches, dizziness, hypoglycemia when taken with sulfonylureas. Is it sulfonylureas? Sulfonylureas. That's how I'm going to pronounce it. And you have rare cases of acute pancreatitis and renal dysfunction. Now, exenatide should not be used in patients with creatinine clearance of less than 30 milliliters per minute. And again, you're going to have some side effects. Now, can you be an anti-diabetic and use this? Now, here's how it's applied. It can be used alone or in combination with other anti-diabetic agents, combination with DPP-4. Inhibitors is not recommended, and they're not FDA approved. So you have to find out if what you're using is FDA approved. Again, you can use it alone, or you can use it with other anti-diabetics agents. Now, in comparison with other anti-diabetic agents, less incidence of hypoglycemia, greater reduction in A1C levels, weight reduction, undesirable effects of other anti-diabetic agents can lead to non-adherence to medications. Primary cause of death in type 2 diabetes patients is cardiovascular disease. GLP-1 agonists lower blood sugar and cholesterol, increase cardiac contractility, and protection against ischemia. Now, when we get into the adjunct to diet and weight control, it works best when combined with healthy diets and physical activity. And this is what I'm telling you. People think they're going to just go ahead. It's just like that weight loss surgery. Individuals think that they don't have to do anything when they get that surgery. Yes, you do. And the only way these medicines work is you got to have some type of physical activity and a healthy diet. Now, basically, when it comes to diet and weight control, it slows progression to type 2 diabetes and it prevents complications. So that's what you're really trying to do. You're trying to better your A1C, but in order for that to happen, you want to slow progression. You want to lower your blood sugar. So under diet and weight control, it slows progression to type 2 diabetes and prevents complications. But you have your medical nutrition therapy. And some of this might be a repeat because you've seen my videos that I did 8, 9 years ago on some of these subjects. Some of the verbiage might be repeated. So you have your MNT, which is your nutritional diagnostic therapy and counseling services for the purpose of disease management, which are furnished by a registered dietitian or nutrition professional. Key components in preventing diabetes, managing diabetes, and preventing associated complications. Now, this is covered by Medicare and many other private and state insurance plans. That's what you need to understand. Is it covered by insurance? Now, current literature supports MNT, which is medical nutrition therapy, as an effective method for treating diabetes. 18 studies reviewed by the American Dietetic Association, which is the ADA. It says 8 were randomized controlled trials. Intervention groups had greater improvements in A1C levels and fasting plasma glucose. Lifestyle modifications play an important role in managing diabetes. Diet. Now, you notice with the GLP-1, trying to lose weight, guess what comes up? Diet and exercise. And in diet, important to reinforce healthy diet types of foods, limiting foods that are high in sugar, salt, and fat. Frequency, eating smaller portions throughout the day. Portion control, got to keep track of your carbohydrate intake. This is a big one, keeping track of carbohydrate intake. So in the nutrition, complex carbohydrates, 55% protein, 20%, 55% complex carbohydrates, protein at 20%, healthy fats at 25%. So high fiber, carbohydrate foods, saturated fat intake of less than 7% of total calories. And you want your minimum trans fat intake. You want a minimum trans fat intake. Physical activity. At least 150 minutes per week of moderate intensity aerobic physical activity. So you can raise your heart rate 50 to 70% of maximum heart rate. Resistance training 3 times a week. Now, 150 minutes per week. That's 2.5 hours per week of moderate. Now, I disagree with that. Well, they're saying 150 minutes. I know where they're getting that from. 5 days a week, 30 minutes. And a good 30 minutes of walking, a good 30 minutes of running, even stretching, that can help. So that's where they're getting that from. And you get 2 days of rest. But what you're doing, you're raising your heart rate. And weight control, even small amounts of weight loss can improve glycemic control. Changes in BMI can reduce A1C and blood pressure, improve lipid levels, reduce cardiovascular risk factors. In addition, there's another thing, and I mentioned it earlier. Sleep. In addition to healthy diet and exercise, sleep also has an important role in weight control. Study found that middle-aged overweight men who slept 8.5 hours burned more fat than patients that slept 5.5 hours. Elevated levels in ghrelin in the blood. After the conclusion here, GLP-1 analogs have several mechanisms of action in the body. GLP-1 analogs advantages over other anti-diabetic agents include less hypoglycemia, better A1C control, no weight gain, and cardio protection. GLP-1 analog therapy is used as an adjunct to healthy diet and exercise. Healthy lifestyle modifications are necessary for successful treatment. Now, going back to all this, I'm just not a fan, and I'm giving you my own opinion. Because, we have all these Ozempics and Mounjaro, all of these drugs that you see on TV. Now, do they actually work? I don't know. I don't use them. But what the mindset of a number of people today, they want everything to be a quick fix. This is what happened to that bariatric surgery. Again, some people were left and they still had fat in areas that needed to be taken care of. And some people, I hate to say it, they actually looked better while they were a larger size than when they actually had the bariatric surgery, particularly if they were abortion. I mean, when you're doing any type of altering to your body, many people don't understand the effects, understand the loss of nutrients, understand that you have to continue to take like this GLP-1. You have to constantly stay on it. But again, something else that wasn't mentioned in the PowerPoint presentation, stress. The biggest killer in the United States is always stress. And stress can lead to cardiovascular disease, which is health, which is your heart. You can do everything correctly. But if you have a lot of stress in your life, that can check you out in a hurry. But even with these drugs, one thing that's always missing is you go back to the old-fashioned way of doing things. And I'm talking about proper sleep, proper diet, for exercise, and less stress. So in other words, you can create all these so-called miracle drugs, but if you think that miracle drug, GLP-1, the applicator, is going to help you lose weight alone, you're badly mistaken. But a lot of these companies out here want to sell product, make a profit, because they know there are a number of naive people out here. Like Botox. Botox does not stop you from aging. You're going to continue to age. That's the function of a body. But we have so many people out here that want all this cosmetic surgery to stay young forever. Doesn't happen. Now, diabetes can be prevented. Now, what I use a little bit of apple cider vinegar. Take less carbs. The main thing is you got to be active and get the right proper sleep. And again, keeping the stress down. That's really the big issue. You have the four big areas: sleep, stress, diet, and exercise. Called the DEST formula: diet, exercise, sleep, and stress. If you can control those areas, guess what? You don't even need GLP-1. But another issue is all this approved by the FDA? How much is it going to cost for your insurance? Will your insurance accept it? Yeah, I just gave you some indications that insurance will accept it. But what's the cost? So overall, when we talk about what is GLP, is it worth it? Well, it's the glucagon-like peptide 1 receptor. Agonists are prescription drugs like Ozempic, Wegovy, and Mounjaro. They basically mimic a natural gut hormone to lower blood sugar, slow digestion, and curb appetite. They're worth it often for significant weight loss or managing type 2 diabetes, but they are expensive, or they can be expensive, and they require long-term use. And the way Americans are, they're not committed to anything. Many individuals, here's what they're going to do. They're going to pick up the GLP-1 receptor. They're going to utilize it, and they're looking for quick results. You're not going to get quick results. And you have to get your body in tune to the injections so your system can get used to the drug, because it can cause upset stomachs. And the way it works is basically mimic your gut hormone to signal that you're full from eating. So in other words, you're lowering your appetite, and you're basically slowing down how fast your stomach empties food. And when it comes to diabetes, the reason why you get diabetes is the amount of insulin that's being released when your blood sugar is high. So what you're looking to do is you want to help your pancreas release insulin when your blood sugars are high. And you want to reduce constant thoughts about food, often called food noise. Overall, there are benefits. According to the data, it's proven weight loss about 10% to 15% of body weight, better blood sugar control and lower A1C, lower risk for heart and kidney disease issues, but you have drawbacks, high cost and potential insurance hurdles, need for long-term use. And if you get away from this GLP-1 applicator, the weight can come back. And you also have common stomach issues like nausea, vomiting, and constipation. And overall, in order to really make the GLP-1 applicator, and even other dietary supplements to work. And I mentioned sleep, stress, dieting, and exercise, where they're all sub branches of lifestyle changes. It's basically what you have to do. You have to change your lifestyle. And some people have a hard time changing their lifestyle. It's like an alcoholic. You've been so comfortable with drinking, get into remission because your body's telling you you can't function without a drink. Well, you got to break that habit. So overall, is this something that I would use? Me, no. It's not a miracle drug. You still have to use proper precautions with this drug. It's like Viagra. It has side effects. I'll get into that later on. Get all these drugs out there like Blue Chew. But there are ways that you can get your blood flowing without any of that. The way you find out how many of these drugs work for controlling weight is research and education. Why? Because a mind is a terrible thing to waste. AKA the United Negro College Fund. That's where I got that from. Want to free your mind, be free thinking. Don't be a sheeple. Because the more knowledge you have, the more power you have. Why? Because knowledge is power. And that's my commentary for this edition of the 401 Talk Zone radio show right here on YouTube. If you like what I just presented, please comment, share, and subscribe. And if you're looking for some STEM content, check out my second channel, the QCIS channel. On that channel, you get a daily dose of science, technology, engineering, and math. Now, here's where you can find me. For the 401 Talk Zone radio show, you can find me right here on YouTube, X formerly Twitter, find me on Truth Social, and Rumble. And for the QCIS channel, find me right here on YouTube, find me on X formerly Twitter, and LinkedIn. Once again, you need to listen to this because it is very pertinent. You have to look at yourself. You can't compare yourself to somebody else because we're all different. Don't get jealous of materials. And if you're offended, then you need to make changes. If you're not offended, this doesn't apply to you, but you need to listen to this. Always be blessed for what you have. Don't worry about what you don't have. Know that the sun always rises in the east and sets in the west. If it doesn't apply, let it fly. But if the shoe fits, wear it. And if you don't like the shoe, just change it. Once again, thank you for listening and viewing this edition of the 411 Talk Zone radio show right here on YouTube. Till next time, my name is Leon Jones. I want you all to have a wonderful, gracious evening. God bless you. I'm out.